Hello everybody, I'm Dr. Pathak from Pathak Dental Clinic, and today we shall show you how an immediate implant is been done, how implant placement is done after extraction. So this is the tooth that we are going to extract and go for immediate implant in the same site. This is the lower molar. We shall show you the x-ray. So root canal was been previously done 5 years back and the tooth is fractured, as you can see. So we should extract the tooth and then place an implant, immediate implant, osteum implant in the same site. So it is very comfortable and easy in such cases to place an immediate implant. So a proper block was been given to the patient, anesthesia was been given, all the medical history was been taken prior to your implant placement. The patient is medically fit. So this is how we are extracting it, as the tooth is already broken, so we shall remove it in the pieces. The first piece came out immediately, as you can see. So this was the mesial root. How clean and neat the extraction has been done, you can see that. After this we shall remove the distal portion that is left over in the socket. So even that came out very easily. So both the root piece are being removed completely from the extraction site. Now we shall clean the site, the extraction site completely, and slightly reflect the flap. So before recording the video, we have taken the consent from the patient. It is very important to take video consent from the patient, either prior to taking a photo or video. Before recording it, it is mandatory for all the doctors to record or to take a consent from the patient to record the video or take a photo. The patient seems to be very comfortable, very cooperative. So this is how the extraction site looks like after removing the tooth. You can see and appreciate how clean and neat the extraction has been done. You can see the fulcral bone over there. And so we shall place an implant in the distal socket of the jaw. We need to understand that it is very important to place an implant where we can get the maximum stability. So we shall go for implant placement in the distal side of the extraction socket. So this is the first drill that we are going to use, that is the lance drill, the pilot drill, to mark the site of osteotomy in the distal socket, and should be done very precisely and gently. This is the second drill of 2.2 into 10. You need proper suction, proper assistant for an implant placement. The osteotomy should be done incrementally. You shouldn't rush while doing osteotomy. A speed of 1000 and torque of 45 is being maintained while doing all the drills with proper coolant, water spray. So this is the third drill of 3.5 into 10. We're going to place an implant of 5 into 10 osteum implant. So you can see how comfortable patient is at this age of like 72, 73. The patient is 73 and still is very calm, composed, comfortable. And this is how we do the osteotomy, by increment diameter of the drill. So we are increasing the diameter of the drill incrementally so that we can place the implant properly. I guess this is the last drill, 5 into 10. And after this drill, will show you the osteotomy site, how properly it has been done. You can see and appreciate how clean the osteotomy site is. Now we shall insert the implant in the same site. It becomes very easy in such cases. So I always advise patient to go for immediate implants. So this is the ostium implant 5x10. You can see we have changed the program where we are maintaining the speed of 25 and 40 torque. Make sure when you place an implant, you are supposed to place it immediately with minimal contact outside the jaw. And here we are just inserting the implant. You can see how smoothly the implant is going because the osteotomy has been done very properly. So we have inserted the implant. It is very stable. You don't have to force the implant. We have to place it very precisely and gently. You can see and appreciate how well the implant is being placed about 2 mm below the crestal bone. We shall show you the same on the X-ray. As you can see, we have placed, his bone is good, the implant is in the center and it looks very good. We'll maximize the photo for you. So it is very important for all the patient to understand that it is not just a screw or implant. You need proper precision and proper steps to place an implant. So we are placing a cover screw over it so that there is no formation of bone over the implant. So we have covered it using the cover screw, and we'll show you how it looks like after placement of cover screw. So this is how it looks. As you can see, a properly placed dental implant in the socket. It's an immediate implant in the lower jaw. Now we shall suture it properly. So this is the implant. You can appreciate it. We have just reflected the flap so that we can suture it properly. And this is how we have sutured the site. Although slight, you can see that implant is visible. So we shall give one more suture at the same site to make sure that the closure is perfect. And this is how we have closed the site, and then we are placing a cotton over there. So the patient was very comfortable, very calm, composed. He understood all the steps. It took 10 minutes for us to place an implant, properly placed implant. We have explained him all the details. See how happy he looks like. And we have explained him that, showing him the X-ray about the implant that we have inserted shall take at least 3 to 4 months to osseointegrate inside the bone, and then how we are going to place a cap over there.